Our next presenter is Mathilde, whose mentor is Corey Locke. And the title of the presentation is Why Are American Mothers Dying in Childbirth? And so if you'll give me just 1 second, I will get our video queued up here and we will be off. As you listen to the presentation, if you have any questions, please feel free to put those in the chat. Our presenter will be unable to answer them directly, but we are going to keep those, record those, and send them on as you deem necessary. Here we go.
Hello, my name is Mathilde Piquet, and today I'm going to talk about maternal mortality in the United States. So maternal mortality has always been an issue. In medieval times, it was common for women to have difficult labors and die at birth. However, there has been a significant improvement in this situation worldwide since the beginning of the 20th century, with the development of modern medicine, and between 2000 and 2017, the maternal mortality ratio dropped by about 38% worldwide. But the US, quite surprisingly for a developed country, did not make progress on the issue. On the contrary, reports came out indicating that maternal mortality rates had doubled in the US between 2000 and 2017. Research also showed that 2 out of 3 maternal deaths were determined to be preventable. So the question that I'm going to answer is, what are the most efficient ways to solve the problem of increasing maternal mortality rates in the United States? I'm going to start with some background information. So according to the World Health Organization, maternal mortality is the death of a woman while pregnant or within 42 days of termination of pregnancy, irrespective of the duration and site of the pregnancy, from any cause related to or aggravated by the pregnancy or its management, but not from accidental or incidental causes. Scholars all over the US have been using this definition as a landmark when discussing the topic. So this chart here displays the main causes of maternal mortality in the US. Cardiovascular conditions, which are conditions related to the heart and blood vessels, are by far the main cause of maternal mortality, with 33.6% of maternal deaths. Then come non-cardiovascular medical conditions and infections, each representing 13.3% of maternal deaths, and obstetric hemorrhage with 11.1%. There are various other causes, such as amniotic fluid embolism, which is when the amniotic fluid enters the bloodstream of the mother and triggers a serious reaction, with 5.4%, hypertensive disorders with 7.8%, and anesthesia complications with 0.8%. Now this graph here shows the evolution of maternal mortality rates in the US. So at first, the country's maternal mortality rates showed a great decline between 1936 and 1956, falling from 56 to 4 per 10,000 live births, and was fairly stable between 56 and 87. However, starting in 1987, the rates considerably increased and are still increasing according to the latest reports by the Center for Disease Control and Prevention. In fact, the country's maternal mortality rate more than doubled from 6.6 to 17.4 per 10,000 live births between 1987 and 2018. Now I'm going to explain the main causes of maternal mortality increase in the United States. Some researchers argue that this increase is partly due to better record keeping, since a pregnancy question was added to the death certificates in 2003. The pregnancy question is a checkbox question asking whether the person who died, if female, was pregnant at the time or within a year of death. Until 2003, death certificates did not include the pregnancy question, which left out many maternal deaths that should have been counted. Although the pregnancy question was added in 2003, states were not required to use it, and some took a while to make the change. Consequently, because data collected was not sufficiently accurate and reliable, the National Center for Health Statistics paused publication of maternal mortality trends between 2007 and 2020. Then in 2018 in the US, over 85% of women dying due to the consequences of pregnancy for childbirth were non-white, and rates for non-Hispanic Black women are 3 times higher than for white women. One of the reasons that explains this difference is that non-white women are generally more likely to have worse overall health than white women, which makes them also more likely to face complications during pregnancy and childbirth. This is linked to the fact that non-white women have lower incomes, so less access to health services. In fact, between 1983 and 2013, white households saw their wealth increase by 14%. But during this same period, Black household wealth declined by 75% and Hispanic household wealth declined by 50%. Another reason for the increase in maternal mortality rates in the US is women's decreasing overall health, with an increase in heart problems and other chronic medical conditions like diabetes and heart diseases. Additionally, theories are that an increase in obesity may be contributing to the problem. In 2015, over 50% of pregnant women in the US were overweight or obese. Furthermore, a study showed a high correlation between maternal health and maternal mortality rates in several countries, which supports the argument that countries with better overall health have lower maternal mortality rates. There has also been an increase in the average age women have a baby in the United States, going from 22.7 years old in 1980 to 26.9 years old in 2018, a record high for the nation. Additionally, over 80% of maternal deaths in the US in 2018 happened to women over 40 years old. Studies revealed that compared to women who go through pregnancy at a younger age, pregnant women aged 40 and older are at a greater risk of hemorrhagic stroke, heart attack, and death from cardiovascular disease. Then another factor that affects maternal mortality is the way a woman gives birth, whether it's a natural delivery or cesarean delivery. Cesareans have become very common, with more than 1 out of 5 women delivering that way in the US. Contrary to what many people believe, cesareans come with more risk than giving birth naturally. Furthermore, the C-section delivery rate performed in the US has significantly increased in the last decade, going from 20.7% in 1996 to 31.9% in 2018. Risk associated with cesarean deliveries vary depending on the woman's physical condition, on the reason for the cesarean surgery, etc. According to the Center for Disease Control and Prevention, over 65% of maternal deaths were preventable in 2018. Maternal death is considered preventable if the committee determines that there was at least some chance of the death being averted by one or more reasonable changes to patient, community, provider, facility, and/or system factors. So if there were fewer preventable maternal deaths, then the maternal mortality ratio would be lower. I reached out to a couple of health professionals and asked them what they thought the current pandemic's impact would be on maternal care. And Dr. Dahi Huang told me that with COVID-19, doctors sometimes forget certain things because they're too focused on the virus, and many consultations are being done virtually. Doctors might be missing things that they would see if the woman had come in. She also explained that many women are scared of going to the hospital when they should be going because they're afraid of the virus. This led to women waiting until the last minute to go to the hospital or arriving at the hospital with cases of hemorrhagic stroke. Dr. Kitrusharo, who's the second person I talked to, also told me that many hospitals have made the decision to not allow men to visit their partner, which seriously takes a toll on the woman's happiness and might increase the likeliness of depression afterward. Also, this decision from hospitals removes an important advocate for the woman. Now I'm going to talk about potential solutions. So the US has already started taking action to improve maternal health, and some of these actions have been successful. The US put in place maternal mortality review committees, also known as MMRCs, which aim to prevent maternal mortality, reduce maternal morbidity, and improve the population health of women. They do so by collecting information to try to understand factors related to death during pregnancy, delivery, and postpartum period, including healthcare and clinical factors. The committees identify, review, and analyze maternal deaths, disseminate findings, and act on the results. Their action cycle is made of 5 steps: case identification, case selection, case abstraction, case review, and review to action. Additionally, the Alliance for Innovation on Maternal Health, also known as AIM, is one of the main national organizations working on improving maternal mortality rates in the US. It is a national data-driven maternal safety and quality improvement initiative. Any US hospital in a participating AIM state or hospital system can join the AIM community of healthcare providers, public health professionals, and cross-sector stakeholders who are working on improving maternal outcomes in the US. Concretely, AIM supports the development and implementation of non-hospital focused maternal safety bundles within community-based organizations and outpatient clinical settings all over the US. Maternal safety bundles are a set of small, straightforward, evidence-based practices which, when implemented collectively and reliably in the delivery setting, have improved patient outcome and reduced maternal mortality. It is also important to advertise concrete ways to eat healthier. The Special Supplemental Nutrition Program for Women, Infants, and Children, also known as WIC, provides federal grants to states for supplemental foods, healthcare referrals, and nutrition education for low-income pregnant and postpartum women, and to infants and children up to the age of 5 who are found to be at nutritional risk. Although these actions have been successful, there is still a lot that can be done. So more than 60% of women in the US do not exercise the recommended amount, and more than 25% do not exercise at all. There are different ways that this issue can be addressed. Cities can provide free indoor and outdoor exercising areas, encourage companies to arrange opportunities for employees to work out, plan childcare arrangements to give women the time to exercise, etc. It is also important to put an emphasis on the stages of women's life prior to pregnancy to improve pregnancy health more successfully. Another way to improve maternal mortality rates in the US would be to improve the quality of the care provided to women. The World Health Organization provided a list of recommendations for the improvement of postnatal care of mothers. It advises that at each postnatal contact, inquiries should continue to be made about general well-being and assessments made regarding different aspects, such as urinary incontinence, breast pain, back pain, emotional well-being, etc. It is also asked that women be told whom to contact for advice when discharged from the hospital. Although care for mothers has been noticed to be of relatively low quality, care for newborns is significantly superior. So, a solution would be to develop integrated care, which is addressing simultaneously the need of both the mother and the baby. This would solve the problem of the mother being neglected due to a focus on the newborn. Setting up integrated care would require models that will allow hospitals to integrate services on the ground and measure the impact they have. Policymakers need to commit to innovating for integrated maternal and newborn health care so that both women and their children thrive in all societies. The American health system also encounters the problem of hospitals being understaffed. Doctors and nurses are rushed with patients and may overlook running tests that are necessary to identify the first signs of serious complications. National Nurses United and various other nurse unions are pushing for states and the federal government to enact patient-to-nurse ratio laws, similar to the one passed in California in 2004, which is the only state currently with a minimum patient-to-nurse ratio law in the US. An emphasis needs to be put on increasing the number of states with a patient-to-nurse ratio law and on encouraging hospitals to hire more nurses to provide more focused care to women and reduce the number of preventable deaths. Maternal mortality is too complex of an issue to be solved in a short period of time. There are numerous factors that come into play, such as women's overall health, access to health for everyone, complications linked to cesarean deliveries, racial disparities, an increase in average pregnancy age, etc. There is also a need for the collection of more accurate data to monitor changes in trends with more exactitude. The US has been working on that, notably by including a pregnancy question to death certificates in 2003. Additionally, some efforts have been made in the United States to improve the situation, but there is still an important amount of work to be done to reach satisfying results. Women also need to be more conscious of the importance of being healthy throughout their whole life to increase the chance of having a smooth pregnancy and delivery. Maternal mortality is an issue that needs to be taken seriously because the lives of many women are at stake. The beginning of a new life should not mean the end of the one that allowed it to be born. The government, organizations, doctors, and nurses, but also women themselves, should do everything in their power to make a difference, even just a small one. Thank you.
Okay. So a round of applause. Oh, sorry. Let me turn my video back on here. There we go. A round of applause for Mathilde. I'm going to turn it over to, oh, lovely. You can actually do rounds of applause. That's the first time. Those are fantastic. I'm going to turn it over to Mathilde's mentor, Dr. Corey Locke, to say a few words.
Great. Thanks, Mariah. So you may be wondering why Mathilde isn't here today, those of you who are here. And this is part of what I wanted to say about her is I think all the students who've produced their honors theses this semester have met some extraordinary challenges, as many of them moved out of their apartments, moved to new situations, had to research in new environments and so forth. Part of that journey for Mathilde was moving to France, back to France very abruptly in the middle of the semester. And it is 7 hours later there, which is why she chose to record her presentation. And I just wanted to say how impressed I was with her throughout that process, that she was positive throughout. She produced very professional work and met her deadlines, even as she was abruptly moving back to another country without even being able to say goodbye to her friends and plan. And she just was very professional, and it just made me all the more impressed with her.
Great, thank you. I was going to say that I'm so impressed that she took the opportunity to pull in and to reach out in the current epidemic to ask questions about what's going on, how is this going to impact. I listen to a lot of podcasts these days, as I'm sure some of you guys do, and this conversation around women, our friend had a baby in December, and so we had been talking in our internal group about, we're really glad the baby came in December, and so I started thinking about all of those mothers and the communities and the networks that they're trying to build out to try and create support for themselves, because this is absolutely not what they envisioned.
Yeah, I agree with exactly what you said, and especially her point about the fewer people you have at the hospital, the fewer advocates you might have. And when you're looking at maternal, just overall health situations, I think she made a really good point there.
Absolutely, absolutely. Are there any questions or any other comments that we'd like to record so that she can see them later?
I was just totally proud of Mathilde for her her performance as a student and as a person in my own class. So she's just fantastic.
Excellent. Okay, well, a round of applause for Mathilde again, from us to her in France. Hopefully she's sleeping and resting and safe and well.
She's lurking.
Even better, even better. So if you just popped in,